So in looking at keeping our spine nice and healthy, first off, we got to make sure that our spine, in Lifetime Family Wellness, we want to make sure that our spinal wellness, we've got proper movement and motion to all the links of the chain. We've got proper mobility so that as we bend backwards and forwards and bend, there's proper movement. A misalignment or subluxation will cause the spine to lock. It will actually cause the spine to move abnormally. These abnormal positions of the spine choke off the nerves that go to the different parts of the body. Like I said, every cell, tissue, and organ of your body has to have a proper nerve supply. So when we do an evaluation, we look at, is the spine straight? Is gravity pushing on it equally? If it's shifted in some way, it's going to keep giving over a period of time and causing that continual stress on your lifeline. This is your lifeline. You need to take care of it. And I tell my patients, if your spine was on your face, you take better care of it. But the problem is, these subluxations, these misalignments of the spine, can lay dormant for many, many years. If they lay dormant, they can undergo a more rapid phase of deterioration. If our spine is out of alignment, if you look at the different phases of what's called decay or degeneration, you have a nice, normal, healthy spine here. Nice, healthy spine, healthy discs. The nerves are very large and wide open. The spaces where the nerves come out are not being occluded or shut down. If you look at the phase 1 problem, you start to see weakening of the little disc pads. This can actually develop early on in life. It can come about from, say, early traumas. The birth process is probably the single most trauma we have on our spine. Little kids playing contact sports, like I said, car accidents, slips and falls, and over a period of years, you start to see some advanced deterioration taking place. Your body has an intelligence within it. We need to work with your own body's intelligence and not put a drug in to try and just mask over the symptoms. These little bony calluses form in response to stress on the body. These bony calluses, or wear and tear of the little disc pad, show that there's been stress there. If you work at realigning the spine, your body's very specific healing process can start to work backwards to allow the body to heal. But there are critical points where you can actually bypass that. And if your spine was like this, if these nerves went to your heart, or your lungs, or your kidneys, or your liver, how healthy is that organ going to be? And unfortunately, you can have a problem developing over a period of years and never even realize how bad and withered these nerves are. You might not have any symptoms whatsoever. In fact, your first symptom might be numbness, or tingling, or loss of strength. So what I want you to think about is, what do we do if we have pressure on a nerve? Now I'm going to use an analogy with a little rubber band. So I'm going to put this around my finger, and we're going to pretend that this is just a nerve as it exits and comes out of the spine. Now these hard bones can put pressure on these soft nerves, causing pressure to decrease the nerve impulse, that message that flows from the brain down along this nerve network. You only have 24 freely movable vertebrae. So these subluxations or misalignments cause that endangering stress. Now what do we do if we have pressure on a nerve? What we will do typically is we will start to maybe feel some effect. Maybe it could be muscle tension or numbness or tingling. And some people might do some sort of massage for that and get some massage work, maybe sometimes for years. Does massage work great? Yes, it does. In fact, we sometimes prescribe that in relationship to a patient's care. So massaging the area brings stimulation to the nerves themselves and reduces the effect. But is the problem still there? Yes, it is. You've still got a choking off of that nerve. Now some people, if they feel some sort of pressure pain, they might try and exercise. So we just join a gym, or we start some sort of exercise or yoga, and we work and we exercise. So we start to exercise. Does that feel better while we're doing it? Yeah, it stimulates. We can actually sometimes stimulate and strengthen our body in a bad position, but the problem is still there. Now, some forms of therapy might need to be done, maybe electrical stimulation, maybe forms of heat or ice. You might try and do those things if you have a problem. But if you do not correct the problem and take stress off the nerve, it's going to continue to deteriorate. Now, what would happen to my finger if it stayed like that? It's actually dying off right now. If I kept that on for a day or a week, I would actually lose this finger. Now, we could do other things if we have that. We could take some medication for it. We could take some anti-inflammatory or some sort of painkiller where it becomes kind of back here. It's like the fire's burning, but we just cut the wires to the alarm and it's behind us. We don't even think about it. It's not sending that message to the top of our conscious mind for pain. Now, in our society, this is a way that we approach our healthcare delivery. We look at things as just waiting until symptoms develop. If this stayed on there and we tried all these things and nothing got better, what do we typically do? Well, we wait till we need a surgery, right? So we just cut the end of it off. What I'm saying is the energy that flows from your brain to the body helps in the process of communication. It is the main way that your body heals. We must remove the pressure off of the nervous system to allow the body to heal. Just by removing that starts to allow vital nerve and blood supply. Just like vital nerve and blood supply coming out of your lifeline goes to all cells and tissues and organs of your body.